And in the morning, you'll notice it more because when you're lying flat, your eyelids are similar level to the heart. So there's more swelling that occurs on the face. That's why you're more puffy in the morning.
Welcome to the Derm Cafe. Our Dermcasts feature cutting-edge topics in the field of dermatology and plastic surgery. So come on in, get cozy with your favorite latte, and join us for today's podcast with your co-hosts, Nicole Brody and Dr. Dave Harvey.
Hi, everyone, and welcome to today's podcast from the Derm Cafe. My name is Nicole Brody, and our amazing Dr. H here to bring you a really awesome podcast on how to improve the visible signs of aging around the eyes. This one for me is really exciting, getting into my 40s, and I'm sure that many of the listeners here will want to know your secret tips and tools. So, Dr. H, let's get into it.
Well, thank you, Nicole. It's great seeing you today and hope everything is well where you are. As a brief disclaimer, all the recommendations I might give on this podcast are just my own opinion. So check with your healthcare professional, and any products I might mention, I don't have any financial interest in. So, but the eyelids, to your point, that's what everybody sees, right? When they look at you, good morning. They can tell if you're tired. Are you angry? Maybe you didn't sleep very well that night. So it's a very unique organ structure because it's how we can look into each other and see how we're feeling. And on the functional side, it's very important too because its vision is so important. So the eyelid structure serves as such an important anatomic area for protection against sun exposure, trauma, so we don't hurt ourselves. So it can be very difficult area to work on and to talk about.
So what makes the eyelid then a challenging area to fall on specific treatments on? Like what kind of treatments can we do? And why is it a little bit more difficult because it's such a sensitive place in our body?
Yeah, absolutely. Well, I think one of the first things about the eyelid is it's a very delicate structure. If you think about skin, as a dermatologic surgeon, it's the thinnest area on the body, relatively speaking, for skin. It's not like the bottom of your sole, which is very thick, or your hand, because we traumatize those with walking and pressure. Eyelid skin is very thin and delicate. And so because of that, and its intricate muscle anatomy, it's a very challenging area to work on. As I said, it has a lot of important functions. It's very beautiful. But because of its delicate nature, you have to address that when you're talking about revisions and treatments with a sort of a critical eye, if you will, no pun intended. But so that's one thing.
Yeah, amazing. And there's also, apart from the surgical treatments, will we be able to find out some things that are more natural or things that we can do that might not include surgery, things like that?
Yeah, absolutely. I think, you mentioned last podcast, drinking a lot of water and sleeping well. There are creams we'll talk about. So a lot of things you can do prior to going to surgery. We'll talk about that. But I wanted to kind of venture off into like eyelid itself and what you might see. Maybe talk about some of the growths on the eyelids. Have you ever had any bumps on the eyelids, Nicole, or anything when you were taking off makeup?
I've had a cyst, I think, but what are some of the common growths around the eyes? I know it's really common. I've seen people with it. I haven't experienced it so much myself, but can you share maybe someone listening has something around their eye or symptoms, signs of something starting?
Absolutely. I'll pop up a slide here on some of the common growths, but there is a type of growth called a milium, M-I-L-I-U-M, which is like a tiny little cyst. And, if you put on makeup a lot or you're using a lot of eye creams and you don't wipe it off, Nicole, wipe off your makeup. The milium can form. Yeah, sometimes you don't want to take that time, rest, go to bed. But so milium is common. And so a good cleansing product, you can look for like OcuSoft wipes. Those are over the counter, or CeraVe foaming cleanser's good just to take off the makeup at night so you don't get those little white bumps. They can be removed, but you try to pick at them and they don't come out. So sometimes you have to use a little lancet.
Can I ask you just quickly then, just as I'm thinking about the whole makeup thing, and I know when sometimes you go out for a late evening, maybe have a wine, you kind of forget to wipe it off, but we'll try really hard, Dr. H, I promise. The thing is, now I'm thinking about actual makeup. It just made me think about makeup itself. Does that have any effect? Like maybe if people are using older makeup that's expired, like eyeliner, things like that. Is there something that we should know about makeup that we should be avoiding in terms of its age?
Yeah, great question. Everything has a shelf life. Maybe the application, the texture of the makeup might not be as evenly applied, but to your point, if it's just sitting around for long periods of time, sometimes bacteria can accumulate. And if you start getting infections, little styes or problems with acne bumps, it might be a time to get a new version of makeup. And then if you have real sensitive eyes, you don't want to use a lot of chemicals in the makeup. Sometimes the liquids have preservatives in them, which can be irritating. Sometimes powders work better. But definitely it's to your point, be sure you're changing out your makeup. If you need to do that cosmetic use test we talked about last time, in case you're worried about an allergy, with maybe a color even, maybe you're doing a type of an eye shade, or type of a rouge near the eye. Those are just some things to keep in mind for sure.
Amazing. Now, I had a really big question for you, especially for the women or the men, actually. Sorry, I'm not going to judge, but the people that are maybe super tired, working a lot, and then we have these dark circles. And I'm going to reveal a big secret that I haven't told anyone in a moment after I hear your tips for dark circles. Something that I did personally to help my dark circles. And I want to ask you some questions about that. But yeah, what are your tips for dark circles?
Yeah, like you said, sleep is important. But dark circles aren't just caused by that. They can be if somebody really has a lot of allergies. They can be prone to puffiness and swelling. Just genetics. Some people, their mom and dad had heavy circles and they'll develop it. A big one is tobacco use. If you ever seen smokers, sometimes they'll tend to have more puffiness on the eyes. And so what basically happens is there are blood vessels in the eye. And as I said, it's very thin. So when these things become taxed or stressed, lack of sleep, tobacco, maybe you stayed up too late, whatever, those little vessels can engorge, they become sluggish. And in the morning, you'll notice it more because when you're lying flat, your eyelids are similar level to the heart. So there's more swelling that occurs on the face. That's why you're more puffy in the morning.
I never knew that. I always wondered why my eyes so puffy in the morning. And I didn't know about the other elements of tobacco use and genetics. That's really, really interesting. So everyone stop smoking. It's bad.
Vaping, smoking, no good.
Okay, so something that I did, I got it as a gift actually. I got fillers in my under my eyes, and honestly, I didn't realize how my bags were until I did this treatment, and it really had a massive effect. Like my dark kind of it just went away basically. Can you share some of that? And don't tell anyone, everyone, okay? I haven't really shared that publicly, but here we go.
What happens in the podcast stays in the podcast, okay? We're just saying that.
I wanted to be naturally with no bags, but yeah, can you share? Because I personally found it an amazing treatment. It was a gift, so I did it. I don't know how much it costs, but could you share that with the viewers? Because I think it was amazing for me, at least.
No, absolutely. I'll talk about more Botox and fillers after a break, but just as a brief item on that, if you have some hollowing, sometimes fillers can help, but they can also make it worse. So you have to have the right patient, because sometimes if you put fillers in the eye, and I'll talk about this and show you some pictures a little bit, you can sometimes get a worsening of the fat pad. So possibly what happened with you is if there was some vessels that were superficial, but you had it in a hollow, almost a crease, if you will, the filler created a separation gap to prevent those vessels from being so easily seen. That's maybe why it helped you.
Amazing. And I know we're going to talk about this in a minute, but I have to tell you, I went with a friend and she had hers kind of a bit more puffy and we didn't understand why. So that's actually exactly
it's a case by case thing. And that's why it's important to go to a board certified dermatologist or plastic surgeon, just because we have the experience to know this is the right patient and this is not.
Super interesting. Okay, we'll get back to that in a minute. I want to talk a little bit about creams quickly and how they work for the eyelid appearance. And if you have any suggestions, people who don't want to do maybe the fillers and just want right now, get off the podcast and have an instant kind of treatment.
Yeah, absolutely. I think creams are helpful. You have to be careful. I think a lot of them, if you have advanced stages of eye aging, may not be the solution, but it can be something to help modify or get you prepped for a procedure. Or if it's a minor issue, you can see improvement. So the creams I like usually have peptides and arnica in them. the peptides can stimulate new collagen. So examples of creams that I recommend for my patients, again, no financial interest, is Revision DEJ cream or Elastin eye cream. These both have, as I mentioned, the peptides to stimulate collagen. They have some antioxidants and arnica, which can help a little bit of the dark discoloration a little bit.
You'll put that, because it's hard, like I'm even trying to write this down. Can you put these in the show notes for everyone as well, so they will have a link?
Yes. I'll have a slide here, and I'll just tell you my recommendations. And another one that I like for patients who may not want to spend a lot of money in a doctor's office, you could try CeraVe Eye Repair Cream by CeraVe. That's a nice one as well. That has that ceramide and hyaluronic acid, so that's a good hydrator.
Okay.
And then one other trick on these creams is if your eyes are puffy when you apply them, keep them in the refrigerator a little. So when you apply the cream, it's cold. That'll kind of combat some of the puffiness too.
Oh,
so that's
amazing.
A little trick.
Dr. H, you're full of amazing ideas. Can I ask you then, because this is what my mum told me, what about the cut cold cucumbers and the tea bags on the eyes? Is that a wives' tale or is that working?
No, I think they can help because, some people like those, people even use a cold spoon on the eye for about, a minute. But yeah, they're just helpful with calming inflammation. Again, how long that'll have an effect, I don't think it's going to be for the whole day. But you mentioned cucumber extracts. Some people like aloe, tea bags, caffeine creams. They make these caffeine patches. There's one by Good Molecules. Again, no financial interest. You just leave it on for a minute or two. So those can be very helpful.
Okay, amazing. So I think that was super helpful. It will be in the show notes. But what do you think? We'll go for a quick break, get everyone to have a cup of tea, have a cup of coffee, or put some cucumbers on their eyes.
Hey, cucumbers, got to get them out and early.
We'll be back after the break. Okay, welcome back, everyone. I hope you have got your cucumbers off your eyes, because now is to talk a little bit about when is the best time to see your dermatologist or plastic surgeon, because you might have been thinking about it for a while, and this is how you're going to know it's time to go see them.
Very good point, Nicole. I think, when the creams aren't cutting it and your frustration level reaches a tipping point, because everything you're trying, from your mom's recommendations to the best over-the-counters that you've been told about on these TV ads.
The cucumbers are not working.
They're not working. You got to see somebody. Yeah. So come see your doc, who's your friendly friend, and that's when you can phone us. We're friendly. So that's probably the time I would say to consider that. And then, we could talk about some other things about that.
Awesome. And can I ask another question? Is there an age that you feel is the age of, I'm going to start thinking about it? Like for me personally, if someone hadn't offered it to me, I probably wouldn't have gone, but I'm so happy that I did. So is there an age, like for me, around your 40s or earlier, or is it just depends? Everyone's skin is different.
Yeah, I think it depends on the patient because, like I said, genetics play a role sometimes. And even young men and women in their 20s, if they have a genetic predisposition for heavy eyelid bags, they may want to see us sooner than later. And it's when they feel it's appropriate. Now, sometimes if somebody wants something and I feel like there's a risk to doing a procedure relevant to the benefit, I'll say, wait, try the creams, be more conservative. But I don't think you can actually put it in a box.
Yeah, that's because you're the best, Dr. H. I really wish that everyone could come to you because you really are the best. I think you would be the best surgeon and dermatologist to go to. So if you're in the area, you should go visit Dr. H.
We'd love to see you. Have a coffee, talk.
Right.
Yeah.
So now, what are some less invasive ways to improve the eyelids appearance? And also, is that like when your eyelids are coming over your eyes a little bit? Maybe.
It's got to be early, though, because if it's too extensive, the conservative treatments would be like your botulinum toxins like Botox, or if some of the fillers you mentioned, and RF treatments. But if the eyelid skin's overhanging too much, we might want to do surgery. So usually these cases are where you might see early crow's feet, or maybe you don't like your brow position. So I have a slide here that I'll pop up, but the Botox can work really well for crow's feet, wrinkles, or if you want to raise your eyebrow a little bit laterally. A lot of women like that openness.
Oh, I feel like do I need to raise my eyebrows for Anyone watching?
They look pretty good. I'm just, but I mean, if you wanted more arch, you could do that. Yeah.
Right,
But
awesome. Amazing.
and then the fillers, to your point, which you had mentioned, usually I like that when people have just really severe tear troughs and you want to get it right in that nasojugal fold, we call it. That really helps. That hollowing can help with the darkness if those vessels are high. You can even do filler around the lateral brow to give it more of a rounded arch. So there's ways to use this in combination.
Okay, and what kind of investment? I know that everyone is different, but roughly, because people might be thinking, okay, but how much does that cost roughly? Is it in their budget? So what is the rough estimate that you can give based on
it's going to vary. Honestly, even in my own city of Atlanta, if you go in town, they're going to charge you double what you might get more peripherally. So it varies, but you're not talking usually like with Botox, maybe, so many dollars per unit. Usually it's around in the States, anywhere you can get it low on end about 8 to 9, at a high end, maybe 17. So there's a little bit of a range, and you might need about 20 to 30 units, say. And then a filler, usually on average runs around $600 to $800, and give or take, depending on the product, how long it lasts, and the doctor's skill set.
Okay, but that's substantially less than having a surgery, right?
It can be. Again, there's variability with that. I think generally that's a true answer, but sometimes if you do need the surgical approaches, this is where the creams are working, the fat pads still are bulging, and to your point, the eyelid skin is hanging over the lash line. So at that point, if you have to do a surgery like a blephroplasty, which I'll talk about, those procedures are going to last longer too. Whereas Botox and fillers, you have to do kind of more often. So it kind of may even out.
Actually, before I ask you about the different types of surgeries, how long does this amazing filler work for me? Because when am I going to need to go get it again?
Yeah, and I think that also depends on your, how well you take care of your skin and do you metabolize it. Like I see like smokers and things, probably they tend to last less. But a filler on the short end will last 6 months. On the long end, maybe you'll get up to 2 years.
Wow.
The average is about 12 months, I would say. For the hyaluronic acids, those are safer to use. And again, you want to go to a board certified dermatologist or plastic surgeon, somebody with a lot of experience when doing fillers around the eye, because there are a lot of important blood vessels and you can get into trouble if you're not careful.
Wow. Okay, so that is a really, really important point. We would not recommend you going to anyone that's not certified. And how do you know if someone isn't certified? And that might sound like a silly question, but maybe someone is promoting themselves. Do you need to see a certificate? What's the warning?
Yeah, you should go online. Normally, for board certified dermatologists, there's a website in the States. We have what's called the American Academy of Dermatology. You can go on there and Google it, or just Google their name. If you're just trying to choose a provider based on Instagram, I don't recommend that. There's been a lot of horror stories on that, but you can check with your medical board, maybe talk to a friend who's had it done, who's gone to somebody who's medically trained. Those would be some options to do.
And one more question, because I see that here a lot. I have been invited, I've never been to Botox and filler parties. I'm not sure if that's a thing in the States, but
it is.
Are they certified or is?
Not always.
Yeah.
The parties are a little risky. Often there's alcohol served. That's also a sticky point for me somewhat, because alcohol is a blood thinner and that can make you bleed. So you just got to be careful. I know sometimes it's you're too careful, but I mean, I just think if the audience is listening, if you're going to any parties and you're getting these really cheap rates, I would raise a question on that, because it is your face. You don't want to have it mucked up.
Amazing. Thanks, Dr. H. I think it's really important because this is becoming kind of fashionable. Like, I've honestly been invited to many of the parties, but I agree with you. If I'm doing anything on my face, I'm not doing it while I'm having a wine, because I'll end up probably sticking Botox in, I don't know where. You know what I mean? Like, it's not a safe environment. You want to be...
Or you moved. You should have moved when you drink.
Yeah, I would be like just drinking my wine while having Botox. Like, I don't think it's a great idea, right? So awesome. Thank you. And in terms of the surgical treatment, what are some of the options if some people are at the phase where they've used all the creams, they've done what they can, and they just really want to go for this route?
Yeah, I think, like I said, couple of approaches. You have to look at the cases. So I'll have a slide here on blephroplasty that I did. And in this patient, there was a lot of puffiness under the eyes. and the eyelid skin was hanging a little bit more. So we removed that and a little bit of the fat pad just to kind of artistically sculpt it as also the lower. And you can see the really nice improvement in this patient. So one thing that we talk about and for the audience is if you think about where your eyelashes are to where your eyelid crease, in a woman, there should be a separation for that. We call that the platform, the eyelid platform. And in a ideal width on that in a female on average is about 8 to 12 millimeters. And in a man, it's about maybe a little less, 5 to 7. So if you're seeing that overhanging skin, probably nothing.
I'm just checking myself here in the video.
I see the platform, Nicole. It looks good. You're good. You're 8 to 12 millimeters.
I didn't do anything yet. So yeah, just a free consultation here, Dr. H. Thank you.
So that's one. And then the other thing, though, that plays a role, and this is another slide, people sometimes just need a brow lift. Their brows are low or they're asymmetrical. So this photo that I'm going to pop up shows how you can raise the brows. That also opens up that platform a little bit too. And the way you know that is if your eyebrow, if you push down, if it's below that bony orbital rim, then you may need a lift. Because when we're younger, that position usually higher. And when we age, because of gravity, it kind of descends. So just something to keep in mind.
Oh, things to look forward to. Thanks.
There are bad news. Sorry.
Yeah, I want to ask you a question because my husband will kill me, but he doesn't listen to this, right? I'm not going to let him. He's got really puffy kind of fat under his eyes. Is that also, it's you couldn't really see it. And I think this is part of hereditary, right? And his background.
Yeah, it can be, sure. That's something that you could do. Now, one thing that's good about the lower lids, if they're just puffiness, but there's good skin texture, like there's not a lot of wrinkles, you could hide the incision on the inside of the eyelid. It's called a posterior approach. And when you do that, we just remove the fat pads from underneath, under local, and a little oral sedation. These people don't have to be intubated or anything. And it's very easy because there's no suturing.
Amazing. Yeah, I'm going to book him in. So anyone listening, for men as well, because, he's a man.
Yeah, I do a lot of men as well for that.
Yeah, awesome, amazing. Great facts there. Thank you.
Well, I just really want to thank everybody. I would love it if you guys really find these podcasts and Dermcasts useful. If you would like us on our new website, which is up, thedermcafe.com, or follow us on Facebook or Instagram. And I have the slides on how to contact me if you have any questions or want to hear any new topics on our podcasts.
Yeah, and also share it. I'm sure this is so helpful for so many people. So would really appreciate if you share it on your Facebook, on your Instagram, with friends. And next time we have a really, really amazing guest, right, Dr. H? And she is going to share funny dermatology tales.
Yeah, a good colleague and friend of mine from our same state, Tony McCullough. I'm really happy to have her as our first board-certified dermatology guest. So we're looking forward to Tony and all of her fun tales. She is a hoot and just a pleasure, and I'm really blessed to call her a friend for sure.
Awesome. And as always, if you have any topics that you want us to cover and talk about, please just email us, jump onto the website and you'll see all the details. But until next time, we want to thank you so much for tuning in, and we'll see you again soon. Bye for now.
Bye-bye.
Thanks for listening to this episode of The Derm Cafe. We hope that you have learned some useful tips from today's Dermcast. Tune in next time as we explore another exciting healthy skin topic. Until then, be good to yourself and your skin.